Welcome, everybody, to Understanding the Human Condition. I'm Dr. James Flowers, your host, and today I'm so excited that Eve Ruff is here. She's an absolute dear friend of mine, a colleague that I've worked with for many years, and Eve is a senior consultant with Clere Consulting. And hello, Eve.
Hi. Hi,
How
Dr. Flowers.
how are you?
I'm really well, thank you.
Even though you
And
flew overnight, all night long from Seattle to Houston and landed here about 5 o'clock this morning,
I did. I still have a smile on my face.
and you look marvelous.
Thank you.
How was your flight?
I don't know
Yeah.
because as soon as I get on that plane, I go to sleep and then the flight attendant wakes me to get off.
You're just like me. It's exactly what
I
happens.
think it's the reduced
Yeah,
air in the plane
it's got to
or
be
just
pressure,
wanting to
the
avoid
comfort.
everything that's around me.
Yeah,
So
absolutely. Have you been flying a lot since COVID?
I actually flew all the way through COVID.
Hmm.
My work is such that I go to where people need me,
Yeah,
and there was a great need during COVID.
yeah, there
So I
was.
traveled quite a bit.
Yeah, you and I have had so many conversations about COVID, how it affected really the human condition and how it affected lives across the world, and mental health, alcoholism, drug addiction, all of that. How did you see the impact of COVID in your consulting life?
One of the things I saw that was particularly disturbing and hard for me as a woman was the number of women who were accustomed to being in the workforce, who were now home with children, and who found themselves resorting to drinking
Yeah,
first later in the day than earlier in the day. So something that had been an innocuous habit kind of flipped a switch
right.
and really became a problem. So that was one thing I saw quite a bit of. Another thing I saw in my work with families is just that pressure building up within the family system
Mm,
to such an extent that without other outlets, we saw a lot of damage.
absolutely. And, when I refer to you, when I'm talking to families about you, or even the clinicians here at J Flowers, I often refer to you as a family systems consultant. What is a family systems consultant for our audience to help them understand?
Well, from my frame of mind, what I mean when I call myself that is I am someone where substance abuse or mental health issues are impacting a family. I go in and really come to understand the dynamics of the family, perhaps multi generational issues
Hmm.
that have transcended the family, and come in with tools and suggestions, not only to help someone in the family who's struggling with
Hmm.
substance abuse, but to help the remaining members of the family.
Right.
And the way I think about it is if you think about an Alexander Calder
Hmm.
mobile, and if it's sitting in the museum and it's very still and it's reached stasis, when you take an identified patient, someone with a substance
Hmm.
use disorder, for example, out of the system, everything goes a little cattywampus. So I come in while all those pieces are shaking and help to regain
That's such an
some.
amazing story because it's so true. You're right. You take that one piece off, and the entire system is just in flux,
And
not sure what to do.
yeah, and I really love seeing how things can stabilize and be prepared because if a loved one is off in treatment for a substance use issue, when they come back into that system, if they have grown and the family hasn't grown, then we don't have healing take place.
Absolutely. And the identified patient comes home, steps back into the system to an unwell family, and oftentimes we see higher rates of relapse at that point.
Absolutely,
Yeah.
absolutely. The flip side, conversely, is also true. One thing that I will often tell family members is I can't promise them that their loved one is going to get well, but I can tell them assuredly that if they do the work, they can see things from a different framework
Absolutely. And respond differently to their
and
loved one.
respond differently.
That's right. Absolutely. How in the world did you decide to become? You have a master's degree, I think, in library computer
I
science. You
do.
were a librarian for 25 years. How in the world did you decide to get into the consulting world in recovery?
Well, It's an interesting
Yeah.
trajectory.
Yeah.
So I worked for many years as a biomedical research librarian. I worked
Hmm.
at a cancer institute in Seattle and at the National Institutes of Health. And I really came to understand cancer as a chronic, relapsing, progressive disease, which, left unchecked, would most likely lead to death. So
Hmm.
that was the framework that I worked in.
Sure.
And people have this misconception about librarians. They think of us in the back room shrinking. I was a very public librarian,
Yeah.
and I was a linker between biomedical knowledge and researchers and consumers who needed knowledge. So I
Gosh.
was very out there. Part of my schema for helping my clinicians who needed knowledge was I kept the bar in the
Hmm.
library, and I would have a drink
At the library.
at the library with every scientist that had downtime in his
Yeah.
experiment or a clinician who came in needing an answer to a question. So what everyone saw was that, yeah, I'd have a drink now
Yeah.
and then with someone. What
Sure.
they didn't know is I was drinking with everyone.
Yeah.
So that led me down the path of substance use
Yeah.
and an alcoholism problem in my 40s,
Yeah.
mid career.
Wow.
And I was very, very fortunate to work for a scientist who said, here's 6 months, figure out what you want to do, but by all means, get better.
Yeah. Yeah.
So I did. And when I came back from a course of treatment and
Hmm.
some aftercare and did some work with my own family, we traveled to India for a while. And I said, I can't go back to what I was doing.
Hmm.
I'm really called to work with the disease that I have,
Hmm.
which also is chronic,
Yeah.
progressive, relapsing.
Right. Absolutely.
So crazy,
It,
but I never look back and question the decision.
no, of course not. And you are one of the nation's leading family consultants. And you, every time I talk to you, you're either on your way to the airport or on your way away from an airport, traveling to some corner of the United States. And oftentimes when I talk to you, you're headed to New York or you're in New York. And you have an affinity for New York because you're from New York.
You know, I am a New Yorker through and through. I grew up in Manhattan, the Bronx, and ultimately the suburbs.
Yep.
But you can leave New York, but I think a piece of your heart always stays
Yeah.
there. So I'm happiest in Dumbo in Brooklyn, walking the streets like I did as a child.
Yeah, that's amazing. Recently, at a small conference in New York with Laura Smith, I believe, she had hosted a small conference, and you and I were there. And you said, "Why don't you stay in Brooklyn at the one hotel?" And I was like, "I'm going to stay in Brooklyn," and I was like, "Yeah, sure." So we both stayed in Brooklyn, and we walked like part of the streets where you grew up, and it was so fun
It was
spending
really
time with
fun.
someone from there that has the passion for New York that you do. But what was your childhood like growing up in New York?
Well, it was really different than most childhoods. I grew up in a communist family
Hmm.
where we had meetings in our house late into the night. I would hear discourse, I would hear arguments, and then I would see grown men make up.
Yeah.
And so I didn't grow up afraid of very much
Right.
because of what I was exposed to. My parents thought it was really important for us to have jobs as
Hmm.
early as possible. And I didn't want to go the way of most of my schoolmates who were candy stripers in
Of
hospitals.
course not.
So I got a job for working for Department of Public Works in the back of a trash truck
Are you kidding?
and just helping to pick up whatever fell to the sidewalk
Yeah.
afterwards.
And how old were you?
I was 14.
Okay.
This is also where I was first exposed to marijuana
Hmm.
because all the guys in the back of the truck were smoking marijuana at the
Sure.
end of the
Yeah.
day. And it wasn't something that appealed to me at the time,
Yeah.
but I saw life
Yeah.
and I saw the richness of life. And like I said earlier, I learned to embrace people of all different stripes.
Sure. Absolutely. And you had quite artistic father.
I did have an artistic
Yeah.
father. My father was an inventor. He did smoke marijuana
Uh-huh.
all day, every day. And when other kids had parents who went off to work, my father slept most of the day. I'd come home from school at 3 o'clock. He was just waking up,
Yeah.
and he'd be at the kitchen table drinking coffee, smoking a 3 pack of Pall Malls.
Wow.
and working on his next invention.
Yeah.
And he did some pretty cool stuff.
He did. Do you mind if I mention a few?
No, I don't mind at all.
So, not very many people know this about you, or your family, but your father invented, this is so wild, when you get
Yeah,
tinfoil out of the tinfoil box, your father invented the razor
that cuts
edge
you
that cuts you every time and has the patent on that.
and had the patent on
Yeah.
it.
And your father also invented the modern day coffee cup lid that folds back from the top and then you can close it. And your father held the patent on that. For
Yes, he had a really, do you know who Rube Goldberg was?
I don't
He
know.
was an inventor, and they used to make these kids models. Like you'd roll a marble and the marble would roll the wheel and the
Yes.
wheel would make the mouse
Mm-hmm.
run. And
Yeah.
that's how we thought about my father. He just had this mind that
Sure.
ran on a different path.
And didn't he invent the grocery bag with a
The
handle?
shopping bag.
The shopping bag.
The shopping bag with
Yeah.
handles for Avon Company.
That's
Remember
so
Ding Dong Avon
absolutely.
Company?
Yeah.
And he was an embarrassment to us as
Oh
kids
my
because he was
goodness.
never dressed
Right. He just sat at the kitchen table, smoked pot, and invented
and
things.
invented
Yeah.
things.
So, what was when you say he was an embarrassment, were you really embarrassed or were you thinking, oh my gosh, my dad's crazy? Or were you just fascinated by his mind?
I didn't come to really appreciate his mind till I went off to college.
Yeah.
And then he started this letter writing campaign with
Mm-hmm.
me. The way, because phone bills were
Mm-hmm.
expensive and it still was long distance rates.
Yeah.
So my father started writing letters to me.
Yeah.
And they really were the first love letters that I ever received. And
Wow.
he talked about the day I was born hanging from a fire escape in New York City, shouting like a gorilla because he was so happy. And so his letters to me really
Mm-hmm.
divulged his mind.
Yeah.
And what my mother used to say is that we were so alike, my father
Mm-hmm.
and I, that we just couldn't get along when we were
Mm-hmm.
young.
Sure.
And then because he outlived my mom for so many years, we just became closer and closer
Yeah.
as the time went on.
Yeah. You definitely have your father's artistic brain.
I think so.
You do. I could tell so many stories about your brain right now.
Yeah, we're not
We're
going to
not going to
share
go
those
there today.
stories.
But
Yeah.
that's so amazing. What an amazing family you grew up in. And in fact, you grew up Jewish. You are Jewish. You were it was during Passover that you had your very first drink of alcohol.
It was. And I was 8 years old. And during the Passover service, you set a place at the table for someone who has nowhere else to go, and
Hmm.
you provide a glass of wine
Hmm.
for this prophet.
Hmm.
And my grandfather used to drink that glass of wine, and the kids would think, oh my gosh, the prophet came to our
Yeah.
house. So when I was 8 years old, my grandfather let me in on his little secret that
Ah.
he was the one who drank the
Hmm.
wine. And he said, why don't you drink it this time?
And you were 8.
I was
Hmm.
8, and I thought, well, that's disgusting. But I drank it, and I will tell you, something washed over me. I mean, I'm 68 years old, and I remember this experience like it was
Hmm.
yesterday. It was a salve. Everything about the world just dripped off of me.
Wow.
Now, mind you, I did not become an alcoholic until my 40s,
Hmm.
but I think the disease was progressing within me from 8 years
Sure.
on.
Absolutely. I've always thought I knew that story and I thought it was an amazing story that you tell that eventually you were an alcoholic. And you talked about your boss, the scientist that said, Eve, it's time to get some help. Here's 6 months. What an amazing gift.
Oh, it was an incredible gift. His
Yeah.
name was Robert Day, and he was the director of the center. Interestingly, the story comes full circle. He gave me this amazing gift. And many years later, when I was working in the treatment industry, he had an adopted daughter who was struggling with alcoholism. And he called me to help find placement for her.
Wow.
And I had the opportunity, usually you're paying it forward.
Sure.
In this case, I actually had the opportunity to give it right
Yeah.
back to them,
Absolutely.
placed her in treatment, and we're still in touch. Even though Dr. Day is no longer with us,
Yeah.
I'm still in touch with his daughter.
That's amazing. I love that
Yes.
story. Yeah. And what do you do in your life? You work with a lot of stress. You work with families who are really torn apart, and families that are going through things that are unimaginable with addiction. How do you keep yourself healthy?
You know what came to mind first?
Yeah,
The very first thing I said, and I can't recommend it for everyone, is I have a 6-year-old grandson.
exactly.
And when I need stress reduction, all I have to do is say, "Can we play Legos?"
That's perfect.
So that's a little bit tongue in cheek, but I mean, I have a really rigorous Al Anon program,
Yep.
and I was a latecomer to Al
Yeah.
Anon, but I had someone who said to me that if I wanted to do this work, I really had to understand where I ended and where my family's began.
That's right.
I have a Peloton. I have an incredible cadre of friends who don't work in the
Hmm.
industry, who are really supportive and don't want to hear stories.
Right. Yeah.
Unless they're really good stories,
Yeah.
then they want to hear
Yeah.
them.
And so that allows you to get away, and
Yeah.
I'm using the word normal, but be normal, be out of
Mhm.
your field, be yourself, and talk about other things than
Yeah.
recovery.
But I think because of my own personal journey of
Hmm.
recovery, because I use a lot of the tools that I learned in
Hmm.
treatment, meditation on a
Hmm.
regular basis,
Yeah.
exercise on a regular basis, good
Hmm.
nutrition to the best of my ability,
Right.
given that I travel
Yeah.
so much. I just really work to have that peripatetic balance in my
Yeah.
life.
Absolutely. Peripatetic. I can tell you're a librarian. I love that.
You
And
know, I was going to tell you one other, just this great
yeah.
story. I worked for a woman early on in my first internship, and she gave me this visual. She said that it was a women's treatment center, a
Hmm.
24-bed women's treatment center, and I was an inpatient counselor intern.
Right.
And she said to me, when you walk in this building, the first thing you do is put on a Teflon raincoat.
Wow.
And she said, it's semi permeable, so what needs to come in will come in.
Mm-hmm.
But everything else has got to be allowed to just drip right off you. Otherwise, you will not be able to do this work.
That's exactly right. Similar story. I had one of my graduate professors often talked about the hat, the professional hat, and leaving the office and going home on a Friday afternoon or an evening and being able to take that hat off. And he said, the advice that I want to give you going into this field is every day when you leave your office, whether you're wearing a hat or not, put your hand on your head and take the hat off and place it on your desk and pat it and tell it you'll see it tomorrow.
Oh, I love
And I've
that.
done that for 32 years.
Yeah, I love that.
And it does help. It actually helps. And I love the story of the Teflon.
Yeah,
Yeah. So tell everybody, how in the world did you get from New York to Seattle? That's a big difference.
it's a big difference. In a blue Ford van with a backpack and a boyfriend,
In
we
1978.
1978, so now you all know how old I am. I married
Hmm.
that boyfriend,
Hmm.
and he's the father of one of my children, and he's still a dear friend. We came to climb Mount Rainier.
Wow.
I had this vision
Hmm.
of climbing that mountain, 14,410 feet of that mountain. We were
Yeah.
living in Philadelphia and in New York, and
Hmm.
we trained on city streets and city buildings. We climbed the World Trade Center tower
Wow.
with 40-pound backpacks on so that we could train to climb Mount Rainier.
That's amazing.
And after going to Mount Rainier,
Hmm.
we went to this beautiful restaurant on the banks of Puget Sound. And I called my mother and I said, Mom, I am not coming back east. I
Yeah.
am staying here in Seattle. It's just too beautiful to
Yeah.
leave. I mean, there was no one in Seattle. Boeing was in trouble.
Yeah.
We didn't lock our cars. I didn't have a key to my house when I first
Wow.
bought my house.
Yeah.
I mean, it's a very different place now, but
Sure.
I mean, it was Shangri La.
So what'd your mom say when you said, I'm not coming home?
My mother said, do they have doctors in Seattle? She was so worried.
Yeah. I bet she was.
Doctors, bagels, that
Yeah,
kind of stuff.
exactly. That's right. That's amazing. What an amazing life you've lived. And, real quick, going back to Mount Rainier, one of the things I love is that when you do travel and when you're flying home, you always take a picture of Mount Rainier and post it on your social media account. And it just shows your love for that. And every time you fly over it, you must have a little bit of memory of the day that you climbed it for the first time.
I have memories of that day. And then I was really fortunate about 15 years ago, so about, 5 or 7
Hmm.
years into my career, I did a fundraiser for the treatment center,
Hmm.
this women's treatment center. We called it One Step at a Time.
Okay.
And I told a group of women that if they were able to amass a solid 12 months of
Mhm.
sobriety, that they could train with me to climb Mount Rainier.
Wow.
And we called it One Step at a Time. It was an amazing experience. We did not summit, but there was more instruction in the fact that we were unable to summit,
Sure.
and the parallels, climbing that mountain,
Hmm.
preparing, doing the work, taking it one step at a time, having to be able to get down the mountain, not
Yeah.
just up the mountain. The parallels were so many. And this small group of women, there were about 13 of them and some guides and me,
Yeah.
are still all in close touch.
That's so
So that
cool.
mountain often is my higher power.
Yeah. Absolutely. I see that. Absolutely. What advice do you give families looking for help for their loved one? We'll wrap up and say, I'd like to know, what advice do you give families during their tumultuous times of, I don't know what to do? What's the steps they take?
Well, the very first thing I tell them is that if they can trust the process, and if they don't have hope, let me carry the hope for them
Hmm.
while they are waiting. So
Yeah.
that's step number one. I encourage them to do all the kinds of things that I do to stay well, because if they are not well, then they can't be there
That's right.
for their family
Yeah.
members. I'm a big reader, and I'm a big proponent of doing somatic work.
Yeah. Yeah.
So I get families not only the coaching that I can offer, but I get them therapeutic support from a somatic
Hmm.
standpoint. And I tell them to let go of control.
Absolutely. Yeah. I'm so happy that I had this time to be able to introduce you. Everyone in the United States in this industry knows Eve Ruff. But for the families out there that don't know Eve Ruff, what an amazing introduction to really allow people to understand who you are as an individual and how you work with families as a consultant. And thank you for taking time.
Well, thank you
Yeah.
so much.
Yeah.
Thank you so much for this opportunity.
If you're open to it, I'd love for you to tell people how they can reach you.
Oh, of course I
You're
am.
so busy, but how do people
No,
reach
I'm
you?
not so busy. And the truth about me is I have really good boundaries,
Hmm.
but I also answer my phone 24/7
Yeah,
because I know that when somebody is struggling, the immediacy of a response is really important.
it
And
is.
as you know, I can go from a dead sleep to having a coaching conversation in no
Just like
time.
that.
So I would say the very best way to reach me is through my cell phone, and I'm glad to give that
You
number.
bet.
It's area code 206-276-4472.
Excellent. And if you have any questions for Jay Flowers, look at our website, jflowershealth.com, or you're welcome to call us at 713-783-6655. And Eve, again, my dear friend, I love you to death, and I absolutely adore working with you. And you have helped so many families that I have worked with, continue to work with, and I look forward to collaborating with you and your team for many, many years.
Thanks, James.
Yeah.
And, working with Clere Consulting team members is a great privilege.
Yeah, absolutely. I love the entire team. So thank you for doing this. Yeah.
Okay.
All right. See ya.